don't look at my eyes, don't look at my eyes, I don't want to contact Apollo. You are infected with Apollo, I don't want you to infect me. Honestly, these are the popular sayings of so many people. When they come across an individual who has been infected with this disease, pink eye, eye redness, Apollo, acute hemorrhagic keratoconjunctivitis, I'm not saying it is bad, but if you be infected, you shall be infected. And mind you, it is not all eye redness that is regarded or as Apollo. You don't regard all eye redness as Apollo. And now that the epidemic of Apollo is about to be unleashed, pay attention to the end of this video to get the essential tips that will help you to protect your eyes and as well get rid of this Apollo. Now, what is this Apollo? It's an inflammation of the conjunctiva that usually produce redness and other signs and symptoms. What are the causes of this conjunctivitis? General cause of conjunctivitis now, we have the one caused by bacteria, we have the one caused by virus, and likewise allergy. When you introduce or you get insect into your eyes, when dust gets into your eyes, they trigger a kind of allergic reaction, even the cosmetic use. So those are some of the causes of eye allergy that will eventually produce redness of the eye. Then we have irritants, like you are trying to spray insecticide and it gets into your eye, it will trigger the redness of the eye. Then you are trying to fuel your car and the petroleum spilled into your eye, definitely it will trigger eye redness. We have foreign body, when sand gets into your eye, dust gets into your eye, and other things that serve as foreign body to the eye, it will trigger the redness of the eye, and so on and so forth. But the one we want to concern about in this video is the one caused by virus, and it is the one that is popularly known as Apollo, that is acute hemorrhagic keratoconjunctivitis. Acute hemorrhagic keratoconjunctivitis, the one caused by virus, is the one we want to discuss about. We have the one caused by virus, we have the one caused by bacteria. But in this video, we are going to tell you the differences, how you should be able to identify the Apollo caused by virus and the one caused by bacteria. But mind you, the one caused by virus, which is acute hemorrhagic keratoconjunctivitis, is the one that is popularly regarded as Apollo. What are the signs and symptoms? How can you identify that this redness of the eye is caused by virus? Number one, there will be tearing, that is consistent production of tears in the eye. You see tears running, consistently running or out of the eyes. Then you have lid swelling, there will be swelling of the lids, and as well there will be congestion of conjunctiva redness, which we call pink eye. The conjunctiva will be very, very red. Some people experience pain as a result of the sandy sensation. It will be as if sand is being poured into the eyes. They will have a kind of discomfort. From this, you have pain. Blurry vision can be there. You have a kind of, blurring of your vision, as if the vision you want to be cloudy. Those are the signs of viral hemorrhagic keratoconjunctivitis. Now that of bacteria, the difference there is in bacteria there will be purulent discharge of the eye. That is, you will see the eye will get stick together by a discharge, and that is the reason why you can identify or differentiate the one caused by virus and the one caused by bacteria. That one of bacteria will produce purulent discharge. Virus don't produce purulent discharge. It is only bacteria that produce purulent eye discharge that will get your eyelid stick together either on waking up or after some times. Also, the bacteria usually have the general signs and symptoms like the lid swelling, then congestion of the conjunctiva, which is eye redness or pink eye, then blurry vision. Then the virus usually causes photophobia. That is, when you go out, you won't be able to focus at the light. Whenever you see a source of light, you won't be able to focus at the light, or you won't be able to focus at the sunlight. Photophobia is very common to virus. But that one of bacteria, it is usually purulent discharge, then blurry vision, lid swelling, they might have little pain, and so on and so forth. Now, what are these probably the treatment? How will you manage conjunctivitis? Now we shall be talking of the general management here. We won't talk much about the drug management because we have to be skeptical. people do misinterpret the drug usage. But I would implore you, when you are suffering from acute hemorrhagic keratoconjunctivitis or any redness of the eye, please go close to a specialist for early detection and prompt treatment that will provide a good and possible prognosis. Now, the main thing we shall be talking about here is eye hygiene. Eye hygiene is very, very important to the eyes, because if you look at the mode of spread of this Apollo, which is acute hemorrhagic keratoconjunctivitis, it can be spread as a result of droplets. That is, the organism gets into the ear and it can be transferred from one place to another as a result of droplet infection. Personal contact with an infected person can also trigger the infection of this virus. That is, by sharing items with an infected person, like maybe handkerchief, collecting keys, because an infected person might have used that hand to touch the eyes and as well, touch any items that you want to collect from them. That are the possible causes that such person can be infected with this disease. Another thing is touching an infected surfaces, because an infected surfaces might an infected person might have touched a surface with the hand that he used to touch the eyes. So by so doing, the surface now that you now touch as an uninfected person, you touch the surface and use that hand to touch your eye, can as well trigger the infection of this virus. And also, we shall now be talking about hand washing. It is very, very important when you touch a surface or you get close contact with an infected person. It is very good you go and wash your hand with soap and water. It is very, very important to prevent you from getting infected by this popular Apollo. Now, I will discourage you against the use of traditional remedies or cultural practices, because so many people have lost their eyes as a result of traditional remedies or cultural practices. I've seen someone that had Apollo and they told him that he should use his first urine in the morning to, clean his face. He did, unknowingly to him, that he has been infected with gonorrhea. And because it's just surfacing, he didn't know. He did so, and the eye got infected. Before you know, he lost the two eyes. Many cases like that we've seen. So some people, they will tell them that they should use breast milk. Some people, they will tell them that you should put honey into the eye. Some they tell them that they should use aloe vera, the fluid of aloe vera, to put it into the eye, and many more. Some they will tell them camphor, that they should put camphor. Some they will tell them onion, that they should put onion fluid into the eye. All these things can trigger an allergy to the eye. And mind you, you are infected with Apollo doesn't mean that your eye cannot be infected by a bacteria. Yes, it can be complicated by a bacteria infection, which will be very, very disastrous to your eye. So I would discourage you against the use of traditional remedies or cultural practices to the eye, because the epidemic of Apollo is about to be unleashed. Please pay attention to all these tips that has been discussed, all these essential tips. They are very, very important to protect your eyes and to help you to get rid of this virus that is producing acute hemorrhagic keratoconjunctivitis. If you have benefited from my video, please try to press the subscription button, like and share my video, so that you can have access to more of my educative videos, because in subsequent videos we shall be talking about specifically bacteria conjunctivitis and allergy conjunctivitis and the possible treatment of them. Thank you. God bless you. Thank you for watching my video.